Hi, I am Dr. Felice Gersh, your integrative OBGYN. And for this episode, we're going to talk about a problem that I deal with my patients regularly. In fact, 100% of the sufferers are female. It's the topic of menstrual migraines. If you look at all migraines, 80% occur in females. I don't want to underestimate the 20% of males who suffer from migraines, but it is predominantly a female problem. And of course, when they're menstrual migraines, it's 100%. So what are we talking about? Why is there such a thing as menstrual migraines? Well, first let me tell you that menstrual migraines are the worst kind of migraines. It turns out that they're longer, more severe, and more difficult to treat. So what is a menstrual migraine? It's a terrible type of a headache that occurs around the time of the period. It typically occurs a couple of days before the first day of bleeding up through the third day of the period. And what is triggering these terrible migraines, these terrible headaches? It turns out it's the drop in estrogen, estradiol, that the ovaries make is believed to be the trigger. So what are the symptoms? Well, of course, a pounding headache, a terrible headache, but often other symptoms will accompany these types of headaches. It can be severe fatigue, nausea, vomiting, and this type of headache is commonly, but not always, associated with aura. So aura means that there are symptoms that occur prior to the headache, which can be like funny flashing lights or a funny smell or just other types of pain, sometimes abdominal pain. So that would be migraine with aura. And a migraine with aura is a more dangerous type and has a higher association with the occurrence of stroke. I don't mean at that moment, but in that individual, migraine with aura is known to have a higher association with a lifetime risk of having a stroke. Now, what could be even happening that a drop of estrogen? Well, let's just go over what the menstrual cycle is and what is happening here with the drop of estrogen. And let me tell you that it's not about having high estrogen. That's like really important to know. The time of a woman's life when the estrogen levels are the ultimately highest is during pregnancy, which turns out to be typically the time when women have the fewest migraines. So it's about the drop. And what happens in a menstrual cycle is when the period starts, the estradiol level is the lowest, and then it rises, and then it spikes up, and that triggers ovulation, and then it dips, and then it comes back up, and it plateaus, and then if you're not pregnant, it comes down again. And it's that downward trend that really is what triggers this whole terrible migraine issue. Now, why would that even happen? Like, what's going on here? Well, it turns out that there's a whole new understanding of what we think is happening that triggers these menstrual migraines. By the way, many women who have menstrual migraines will have other migraines that are not related to the period itself. They are tending to be less severe and shorter in duration. But women can have menstrual migraines with or without other migraines. And when women have migraines where they're happening many times of the month or the week, those we would call chronic migraines. And when they just happen sporadically, that would be acute migraines. And women, like I mentioned, with menstrual migraines can have other types of related migraines as well. So in terms of this menstrual migraine, which is triggered by the drop, which is so severe, it's believed that it has to do with the autonomic nervous system. The autonomic nervous system is what controls everything in the body that we don't think about. like our temperature, sweating, our pulse, whether our arteries are constricted or relaxed, how our digestive system is working, the motility of the gut. So also our bladder, whether it's contracting or not. So all the different things of the body that we don't think about that control themselves automatically is the autonomic nervous system. Now, the neurotransmitters, it's a neurological system, the neurotransmitters that deal with the autonomic nervous system, which has two components. The parasympathetic, which is the state that it should be naturally. It's kind of calm and relaxed. The arteries are dilated. All's well with the world. The pulse is good. Nothing is happening. Motility of the gut is normal. Digestion is normal. That's the parasympathetic, controlled by the vagus nerve. And then there is the other part, the sympathetic, which is like the stress reaction, which should only be activated when you have a need for a stress reaction, which would be if you're infected, like with a pathogen, like you're getting an infection with a virus or a bacteria, or if you're injured, a trauma. So that's what would trigger the activation of the sympathetic or stress part of the autonomic nervous system. Well, estradiol, the estrogen that's made by the ovaries, actually modulates or regulates the autonomic nervous system. A lot of people didn't know that. A lot of doctors still don't know that. And the neurotransmitter that's involved in the parasympathetic or the calming state, that is acetylcholine. Without enough estradiol, you don't make enough acetylcholine, and vagal tone, the parasympathetic part, decreases, and sympathetic becomes more dominant, like stress reaction. And that sympathetic part of the autonomic nervous system has neurotransmitters, epinephrine and norepinephrine. They're the ones that make your heart beat faster, constrict your arteries, and make you feel more stressed. That is also modulated, not exactly the same way, but related to estradiol levels. When you have low estradiol levels, you're going to have more of the stress part, the sympathetic, and reduction in the calming parasympathetic. So what happens when you have that drop of estradiol is you have a drop in the calming part of the autonomic nervous system and a big upshoot of the sympathetic or stressor part. You will have more inflammation. It turns out that when you have stress, when you have the stressor response, you need to have more inflammation because remember, if you're getting an infection, you want your immune system to create the response to fight the infection. If you have an injury or a trauma, you also want to have your immune system become activated, which is pro-inflammatory, to deal with the injury so that you don't get an infection on top of the injury, that you wall off bleeding with blood clotting or infections that may be developing from your injury. So you want to have an activated immune system and be pro-inflammatory under those appropriate situations. But when you have this sudden drop, for a short period of time, you're going to activate your immune system to become pro-inflammatory. Well, in the brain, there is an immune system that's embedded that involves specialized immune cells called the microglia. And they'll become activated by this drop in the parasympathetic and uptick of the sympathetic, creating this stress situation. And that creates inflammation in the brain. You're going to have sudden constriction of the arteries that feed the brain. You're going to have inflammation in the brain, and you're going to have this stressor response. That is why one of the treatments for migraines, including menstrual migraines, is a vagus nerve stimulator, and that will increase parasympathetic and decrease sympathetic. So that's one way that is non-pharmaceutical, because there are pharmaceutical treatments, which I'm going to touch on, but that is one of the non-pharmaceuticals. You can also incorporate other techniques to try to increase the parasympathetic, but they're not going to be as aggressive in terms of their response, and that would be things like mindfulness meditation, guided imagery, having slow breathing, and so on, and including things like acupuncture. So for prevention, we can incorporate a lot of these techniques to increase parasympathetic and decrease sympathetic. And utilizing a vagus nerve stimulator can be actually very beneficial. In fact, vagus nerve stimulators are FDA approved for treating migraines. And I utilize them in my practice now routinely with very good results. But you can layer some of the different treatments. So another way that we can approach this is by trying to prevent the drop of estradiol. Now, how can we prevent the drop of estradiol? The menstrual cycle is what it is. Well, we can give a prescription for estradiol. So this is another technique that I have utilized for years with very beneficial results. I will prescribe typically the highest dose estradiol patch for the patient to put on the lower abdomen, and you change the patch twice a week, starting a week before the period is expected, and then using it through the first, say, 4 days of the period. So that will keep the drop from being too significant. There'll be some drop, but keep it from plummeting. If a woman is given oral contraceptives, we can also, and because when you give women oral contraceptives, they are going to have placebo pills when they're supposed to bleed. And the vast majority of women who are given oral contraceptives will, if they're prone to menstrual migraines, they're going to have them during those placebo pills. And they can be pretty darn severe. So one approach is to take birth control pills. I think, I'm not a huge fan, but there are definitely uses for them. And from a medical point of view and to prevent pregnancies, we have to do what we have to do given the situation. So if you're on birth control pills and you have the placebo pills, you can use estrogen, additional add-on estrogen, no progestin, just estrogen in some form. It could be an oral, it could be ethinyl estradiol, it could be a patch, but you give estrogen in some form during the placebo days of the birth control pill. You can also use birth control pills for many weeks continuously and then do a short break and add in topical estrogen or oral estrogen. Another form of birth control pills, which are not used anywhere near enough, and now they're over the counter, are the progestin-only pills. If you have a progestin-only pill, and they're both prescription and as well, you can buy them over the counter now, you can take them every single day. And in fact, most of them, two of the 3 types that are available, you're supposed to, in fact, in order for them to be functional as a contraceptive, you have to take them every single day. And guess what? You're not going to have that estrogen drop at all. So that may be the ticket to success if a woman needs contraception and has a history or tendency to menstrual migraines, is to use a progestin-only pill with no estradiol. And if you use like the one that's over the counter or the one that's prescription that you take every day, then you actually block ovulation about 50% of the time, but you don't block all production of estradiol. So it's not ideal. It's not like having a natural cycle, but women with menstrual migraines are having really big problems with their natural cycles. So it's really a reasonable option to use a progestin-only pill. Now, for years, we have used all kinds of drugs, many of them off-label, to try to treat menstrual migraines. Things like antidepressants, we have used muscle relaxants, we have used drugs that are anti-seizure drugs to try to help with these menstrual migraines, and sometimes they're still used. Then there's another group called the Triptans, which are specific for migraines, and they often work, but they often don't work for menstrual migraines. So they can be reasonable to try. And then there's a whole new category of drugs that are quite new. You see probably them advertised on television. There's two mechanisms. They are dealing with what are called peptides, CGRP. I won't go into what those letters stand for because it really doesn't make a lot of difference for any of us right this minute. But this is a type of a peptide that tends to be at a higher level in women who have migraines and menstrual migraines. And now there are drugs available. There's called monoclonal antibodies. And these monoclonal antibodies can block the production of this peptide, or a different related set of drugs, they block the receptor for these peptides. And by doing so, it has been a game changer for women who suffer from both migraines of different sorts and menstrual migraines. In studies that have been done, and some of them are very recent studies, they have shown a significant reduction in the number of days that the women are suffering. Say, instead of having 5 or 6 days where they're having a menstrual migraine, it goes down to 2. Instead of the pain being at a level of 9, it may drop to 5 or 6. But notice it hasn't resolved the whole thing. But what has also been shown is that if you then team these new types of monoclonal antibody drugs with other menstrual treatment drugs that have been around for much longer, for very long, like the triptans, and even simple things like NSAIDs, drugs like ibuprofen and naproxen. If you team them, the other drugs become actually more effective. So then you can even lower the number of days and the severity of the pain that much more. And these drugs can also, these drugs that deal with this peptide, can be used acutely. Some of them can be used acutely for the acute onset of the migraine, and they could also be used as a prevention to try to prevent the migraine from occurring. So as I said, these new categories of drugs are game changers in the world of migraine treatment. And don't forget some of the mainstays, though. How about magnesium? How about getting adequate sleep? How about exercise? How about eating an anti-inflammatory diet filled with antioxidants and fiber and lots of vitamins, nutrients, minerals, and so on? They have shown that women who follow an anti-inflammatory diet can reduce their incidence of migraines, including menstrual migraines, by 50%. Don't underestimate the power of food. And in food, you can also eat phytoestrogens. And phytoestrogens are found in almost all vegetables, seeds, nuts, legumes like beans, with amazing results, and fruit. So if you eat a high plant-based diet across all the colors of the rainbow, it's amazing. These phytoestrogens can actually lower the incidence of these horrible, life-altering, debilitating, often creating women having to go to bed for days and not be able to function, not go to school, not go to work. It can dramatically, 50% reduction just by eating a high antioxidant polyphenol phytoestrogen containing diet. And don't underestimate the power of the gut microbiome, because you can make, with eating a high fiber diet, you make butyrate, a short chain fatty acid, a metabolite of fermentation of fiber by the gut microbes. And this wonderful short-chain fatty acid can actually bind to receptors on the vagus nerve and increase parasympathetic output, increase vagal tone, and lower many symptoms associated with migraines, like the gut issues I mentioned, like nausea and vomiting, and also reduce pain sensations that are associated, of course, with the migraines. So nurturing your gut microbiome, eating a wonderful, healthy, plant-based diet, exercise, working on sleep. There are many triggers to migraines that can exacerbate these migraines, like alcohol, like caffeine, like high sugar diets, high fructose, and stress. That's why doing things like mindfulness meditation, taking nature walks, learning yoga breathing, deep breathing, these can be amazing for maybe not eradicating all menstrual migraines and other forms of migraines, but dramatically reducing their severity. So I'm totally thrilled with the new breakthrough drugs that are out there, but let's not forget the foundations of health that can really maintain our stability of our immune system, lower inflammation, maintain a functional autonomic nervous system with predominantly vagal tone, so we have more parasympathetic, and all of this is possible. And menstrual migraines should not be destructive to any woman's life anymore.